and I appreciate your testimony today. We just heard that 1,777 dismemberment abortions were performed in Michigan in 2017. How many did you perform that year?
So I don't have exact numbers with me, but I do perform dilation and evacuation abortions.
Well, perhaps what you could do for the committee and for all of us here is kind of explain that process. What does the mother have to do to prepare, and how does the procedure go? And I'd like some detail in the step-by-step process, if you would.
Absolutely, I'd be happy to provide that. So before any procedure, a patient is counseled on, just like any other medical procedure, the risks, the benefits, and the alternatives, and then the procedure is explained in the informed consent process. So it is our medical duty to talk to the patient about risks of complications of the procedure, as well as alternatives such as parenting, adoption, if those options exist. Then the patient typically, depending on the gestational age, goes through a process of cervical ripening where the cervix is made softer or opened, often using something called laminaria. And then the patient goes through the dilation and evacuation procedure where the fetal parts are removed using forceps or grasping tools until the uterus is completely emptied.
A follow-up, if I may, Mr. Chair. And when you say the fetal parts are removed, is that done in any particular order, and are they all accounted for when the process is done?
So it's done in accordance with medical standards to what is safest for the woman. So it is safest to try to grasp the fetal parts that are closest to the opening, the bottom portion of the uterus. So it's done in the order that makes the most medical sense for emptying the uterus in the way that is safest for the mother.
You didn't answer the question about, are all the parts accounted for when the procedure is done?
Oh, sorry, I missed that. Yes, all of the parts are accounted for when the procedure is done.
And you do that part too?
Yes, that is correct.
Thank you.